Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to introduce our guest today as we speak about Oak Bend emergency rooms. Christy Hoke has a Master's of Science in Nursing. She is a registered nurse as well as a certified emergency nurse. Christy has been a part of the Oak Bend family for 1 year and is currently the ECC or Emergency Room Clinical Manager for all 3 hospital locations. Christy, we are so happy to have you today.
Thank you, Donna. Thank you. I greatly appreciate you taking the time to speak with me today, as I think getting the word out about our ERs is extremely important here at Oak Bend.
You've had a tough go.
It's been rough. Some weeks are a day-by-day basis, but we keep plugging along and do what we do best and provide the top-notch quality care to our community and surrounding areas.
And y'all are amazing. And I want to take the time to thank you and all of your staff for digging in. This staff, bless their hearts, sometimes don't even know what a bathroom break is or food. They are going at 100 miles an hour with a smile. So
Absolutely.
My hat's off to all the staff.
Thank you, Donna. I appreciate that. And I'll definitely send that word along.
Oak Bend has a no wait ER. What does that mean?
So as a patient, once you arrive to Oak Bend and get registered with our patient access team, a nurse or qualified individual will triage you and get you in the back as quickly as possible. Our goal is to have patients triaged within 15 minutes of arrival, and then we will place you in the appropriate bed or room according to your needs. So with this quick assessment process, we are able to address those critical needs that brought you to the emergency department in the first place.
Okay. So when we're coming to the emergency room, most of the time, most people wait till it's just, oh my God, I got to go now. But there
Right.
are some things I'm sure that we could bring with us when we're coming to the ER that would make our diagnosis and our process a little faster. Can you share what those might be?
Absolutely. So first and foremost, please bring a state issued ID, whether it be a driver's license or just an identification card, and any insurance cards, whether it be Medicare, Medicaid, or a private insurance, Blue Cross Blue Shield. And then also, we love for you to bring your home medication list, which should include any allergies that you have to medications, as well as a list for your current medical conditions and any past surgical history. Not only is this important to bring to an emergency room, but it's also very good to get in the habit of keeping these items in your wallet or in your purse for a time when, say you are at a restaurant and you are eating and something happened and they need to contact emergency medical services to help you. These items will help them in knowing which direction they have to go in regards to a treatment plan and then get you to the most appropriate facility.
Great. And I also want to add, because it was my mother's thing, she had a metal valve. And it was really important that we let the staff know that she had a metal heart valve.
Absolutely.
So any implants?
Things like a pacemaker, you should have a small card that tells us what type of pacemaker you have. If you have certain heart conditions, you can get a necklace, you can get a bracelet. Seizure disorders, those things, you can get the accessories. That way, if something happens and you actually fall out in a public place and you're having a seizure, other people can notice those bracelets or those necklaces and realize, oh, this is an emergent condition. We need to call 911.
Great information. So sometimes when we come to the emergency room, we're embarrassed. Nobody wants to admit certain things. I'm sure you've heard it and seen it all, but can that harm our outcomes by not sharing those things that are embarrassing or whatever.
Absolutely. So first and foremost, before we get into the importance of those things, as a licensed medical provider, we are here to provide the appropriate treatment for your current emergent condition. With that being said, the importance of being honest and giving those specific details allows us to choose the correct treatment path. So if you choose to leave out pertinent information, that can cause not only a delay in treatment, but it can cause something that is life-threatening or detrimental to your health to be completely missed. So in order to be put on the right medications to treat your condition, in order to have the right testing, it is very, very important for us to know all aspects of your current issue. And by no means, we don't want anybody to ever feel embarrassed. As we are here to help you, nobody here will ever be judgmental in regards to your concerns.
So COVID's kind of changed the way the flow of the emergency rooms and the amount of people coming through. Can people just come to the ER for a COVID test?
So emergency rooms today have been extremely overwhelmed with COVID. The one thing, not just as Oak Bend, but as an ER across the board, Oak Bend, not a clinical testing site. So what that means is, say, Donna, you come in, you have an issue, you're going to get registered. Every patient requires a visit with the doctor, nurse practitioner, or physician's assistant, whoever the provider is that day. And it is up to them on their recommendations. So those recommendations could include lab work, a breathing treatment, a chest x-ray, a CAT scan, and it could include a COVID test. It is not guaranteed. So with that being said, if the only thing that you are looking for, you need a COVID test to return to work, you need a COVID test because you were around somebody last week who was COVID and you're just concerned, there are testing sites available, and you can get on our Texas Department of Health website. They give testing sites, as well as Walgreens, CVS, and then also there is a new program now where private insurance companies are required to pay for the COVID testing. So you can actually get 2 free tests in the mail. Again, just get on your Department of Health website and they can direct you with all of that.
So with COVID really inundating the emergency rooms and with all the other things that are coming in, wrecks, all kinds of stuff, we do have people that come to the emergency room sometimes as a doctor's visit because the doctor's offices are closed and I don't feel good, so I want to come here. Do you want to address that during this time?
Absolutely. So it goes into the difference between primary care versus urgent care versus emergency care. So let's start with primary care. Primary care takes care of those routine, semi-annual, annual visits, or if you have a very minor issue that can wait a couple days until you're able to get that appointment scheduled. Urgent care deals with minor illnesses that you feel cannot wait till tomorrow, but yet you can't get in to see your doctor today. Examples of that: common colds, sinus issues, you feel like you have an earache, those kind of things. When it comes to the emergency department visits, emergency care is for those life and limb threatening emergent conditions. So do you have a sudden onset of chest pain, a sudden onset of shortness of breath? Were you in a terrible vehicle accident? Did you have an accident at home where you have a large cut that needs sutures? Did you fall and hit your head? Those are the things that we treat here in the emergency department. And with the word sudden onset, I think that's extremely important also to understand. So there are some conditions, shortness of breath or chest pain, When you know that 30 minutes ago, I didn't have this issue and now I do, it becomes emergent.
Okay. And Oak Bend does have a virtual urgent care for those earaches and colds and things. And what we want to do is allow the ER nurses to focus on those urgent emergency things that need to be addressed.
Right.
So sometimes I hear in the no wait ER, it's great and it moves things along faster. But why does it take so long sometimes in the ER?
A couple different reasons as to why that can occur. So first and foremost, when you come into the emergency room, always expect to have testing ordered, whether it be lab tests, x-ray tests. On an average, a lab test and any x-ray, meaning CT, MRI, anything like that, takes 45 to 60 minutes to obtain a result after the study has been completed. Okay, so right there, we're already looking at an hour, and that's just result time. So another reason that could make you feel like it's such a long process is we could have had a traumatic patient arrive. We could have had a very critical patient arrive to where they have an issue that we are working diligently to be that lifesaver, to be that family's comfort. So to understand the broad aspect of the difference in what we call acuity or severity, that's something that needs to be seen across the board. So there may be other things going on that you as the patient aren't aware of, but absolute promise, you will not be forgotten. You will be taken care of.
Christy, you and your team have been amazing and really brought this to the forefront. And I've seen so much compassion in that ER, taking care of loved ones. It's just amazing because you're watching people are coding or people are really sick and y'all are split in 100 different directions. Is there anything you want this community to know? I can't express the passion that I see in the emergency room. And unfortunately, there's not always good outcomes.
Right. There are days that are harder than others. Absolutely. Because we are here to be that emergent medical provider for our entire community. So we want our community to know that when you walk through the doors of Oak Bend, we look at you as a mother, a father, a brother, or even just a friend. We know that you have people that depend on you, and we want you to know that you can depend on us. We are here to provide the emergent needs to get you healthy again.
So I'm going to put you in a spot, and I don't mean to do this, but I want to hear your take on it. So we've seen a lot of COVID come in, and y'all work amazingly to get this resolved because we have seen some bad outcomes with COVID. And we hear about the vaccine and everything. So you kind of see people that are vaccinated, not vaccinated, the whole 9 yards. How do you sum that up for us as an ER nurse?
As an ER nurse, the importance of vaccinations has become such a topic worldwide, as we all know. So when you look at the COVID vaccine, we have to look back as to when COVID originated and the detriment that it put not only on the people who contracted COVID, but also the healthcare in general. Then when you move forward and you see that the vaccine was available and people started obtaining the vaccine and then the second dose and then the booster, look at how the numbers have decreased and allow the data to speak for itself. The variants have gotten less severe, but when you look at vaccination status as a whole, we still can contract COVID. That's a given. But our ability to fight it and our ability to become healthy again is that much more prevalent.
So, in saying that, I think I have COVID, or anybody has COVID. And when do I go, or do I go to the emergency room?
If you think that you have COVID, first and foremost, how are you feeling overall? Are you short of breath? When you get up and walk around, do you have what we call dyspnea on exertion? That means when you are up walking from your living room to the bathroom, you become short of breath. Those are the times that we want you to come to the emergency room. If you have signs and symptoms of a common cold, which is very, very common with COVID, runny nose, slight dry cough, headache, malaise, fever, hydrate, 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 and get some rest. Just because you think you have COVID does not mean that you are having an emergent condition that is life-threatening.
Great. And I hope that clears up. I think people hear COVID and you immediately panic because we've all seen what happens.
It's scary. It's scary, absolutely, because we've seen how this came about so sudden and how it affected millions worldwide.
Right.
And to know what can happen, but take a minute and become educated on the subject, read, research, and don't ever forget to ask questions.
I also know that we're seeing a lot more violence, depression, suicidal attempts, and those things. As an ER nurse and a professional, what would you say to our community?
As an ER nurse, the one thing that I want our community to remember is the word community. Lean on each other, respect each other, and know that you have resources to help you at any time of need. There are resources through Oak Bend, the county, the state. You are never alone.
That is amazing, Christy. That is the true form of our professional staff at Oak Bend. I don't care where you go on the floor. Again, not all outcomes are what you want, but these are some of the best nurses I've ever met in my life, and I'm proud to be a part of that. Christy, is there anything else you'd like us to know or anything you'd like to say?
I think we've covered all of the main points of the purpose of the emergency department here at Oak Bend. We will continue daily to push to give the best quality care, provide safety and comfort for our community and surrounding areas.
Christy, I want to thank you for joining us today. And a big thank you to all our listeners that are tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. And as Christy just said, you're never alone. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.